See, post-operative instructions after the liposuction surgery. See, probably you have finished your surgery today, and this video will give you a lot of information. Please do watch carefully to understand the post-operative recovery period. See, after surgery, we won't close the the incision sites in after liposuction nowadays. Because of this, what you have is continuous leakage of fluid, sometimes a blood stain fluid, and soil the whole mattress and that whole room. So why we do this is because when we close the wound, recovery is slower, that pain is little more. So if you leave that fluid to come out, your recovery is very faster and bruising is less. So some people, this fluid leakage will be there for 3-4 days, some people even 7-8 days, even up to 10 days, but it is worth it. Believe us, it's really worth it to for the faster recovery. And so because of the leakage of the fluid, we don't put the compression garment for the first few days. Usually we will be given a tight plasters all around. So even if it leakages, it plaster gets stained, you can keep that area dry. Either you use the tissue papers to clean that. Usually we give the sterile gauze when you are getting discharged. Use the sterile gauze to clean that areas, and use a lot of underpads when you are lying down in the bed. Usually third day or fourth day, we ask you to come for the plaster removal and the garment application. So usually why we are doing that part is because if you use the garment in the day one itself, the garment just gets spoiled. Because of that, we are using it on third or fourth day. So when the garment, usually the third, fourth day, the secretions will come down. But if it is still there, usually we pack that area with a lot of pads so that it won't soil your garment. So after the fourth day, you have to come back on 7th or 8th day. Usually what we do is we close the few areas, we leave the few areas open. So the closed areas, we have to remove the stitches on 7th day. So you have to come on 7th or 8th day. And during this time, what you go through is a lot of pain. Depends on the area. Usually upper body pain is little less compared to the lower body liposuction. Lower body liposuction, whatever we do, you feel the pain for sure. Whatever painkiller we do, that some kind of a nagging pain will be there. For the lower body, sometimes even 10 to 15 days you will have the pain. Upper body, usually you recover faster. So bruising, that is redness and swelling, are very common after the liposuction. Sometimes very rarely we see superficial peeling of the skin. So usually after the plaster removal, what we do is we'll ask you to apply the moisturizing cream almost twice a day for almost another 30 days, because after the liposuction all your sweat glands will be little lazy, so you don't secrete the sweat adequately, so that moisturizing effect of the sweat won't be there. Because of that, your area, the skin become very itchy. So to avoid that, you have to use the moisturizing cream twice a day for a period of month after surgery. The healing phase, sometimes you feel intense itching. It's not controllable by any means. Sometimes it happens because of the moisture loss in your skin. As I said earlier, because of the sweat glands are not working properly in the initial phase, your skin might be dry, so that dryness also produces itchiness. Sometimes in the healing phase, the growing nerves and a lot of the histamines are released. Because of that, you get a lot of itching in that body. It will be relieved by some antihistamine medication like Avil or Allegra and those kind of medications. Sometimes even medication might not help. It will stay there for 1 or 2 days, then it automatically disappears. Sometimes it's really disturbing problem for the patients. Sometimes some people, because of the allergy to the pressure garment, they get the itching. Sometimes we change the pressure garment from one material to the other, it might stop. After 10 days from the time of surgery, we want you to go for a lymphatic massage therapy. That is, usually you come to a center, our staffs will help you for the small massage. You have to do at least twice a week for subsequent 3-4 weeks. That helps in reducing the swelling and reducing the pain and reducing the bruising a lot. And ice packs can be applied in the initial first 2 weeks. Usually use the ice packs, cover the ice packs with the towel and then apply it. Don't apply the ice directly over the skin, because your skin will be numb. Sometimes that itself burn your skin. Same way, don't keep it for a longer time in the same place. You have to keep moving the ice packs continuously. We will be giving you antibiotic, painkillers, some ulcer protective drugs, and swelling reduction. For the swelling reduction, we give vitamin C, arnica, and those things will, you have to take it as prescribed by our team.